please give a warm welcome to Galym Imanbayev, partner, Lightspeed Venture Partners.
Hi, everyone. Good afternoon. Thank you, Chris and Judd, for the invitation. My name is Galym Imanbayev. I'm a physician by training and partner at Lightspeed Venture Partners, a Silicon Valley-based multi-stage, multi-sector venture capital fund. It's an honor to stand here before you all at the Lion Forum in full appreciation of the gravity and legacy of Senator Ted Kennedy and his contributions to both healthcare and the American dream. As a child refugee and immigrant from Kazakhstan, his aspirations resonates with me and my family on a spiritual level. Today, we stand at the threshold of potentially healthcare's greatest leap forward. Artificial intelligence promises to deliver what has eluded us for generations. Truly personalized medicine that predicts illness before symptoms appear, treatments tailored to our individual biology, and dramatic cost reductions that can make world-class care accessible to every American. This isn't science fiction anymore. The atomic inputs and outputs and computational power to achieve that future are here. But between today and that tomorrow lies a challenging path. As we chart this course, legitimate concerns arise. Patient privacy must be sacrosanct in the age of data. Regulatory frameworks must protect our most vulnerable citizens. And we must ensure that AI's benefits reach rural communities and underserved populations, not just the privileged. These are the common and necessary discussions, and we must have them. But there's a different type of resistance we must confront that I want to talk with you about today, one that's harder to discuss in polite company. Let me share an uncomfortable truth about American healthcare economics. We all know the stats that we spend now more than $5 trillion on US healthcare as an aggregate. My colleague Caitlin covered that pretty well. We spend about $1 trillion on administrative tasks alone. That's more than the entire GDP of about 15 countries. That's $3,000 for every American every year, not spent on healing, but on paperwork. But here's the paradox we must face. What we call inefficiency is actually someone's business model, someone's revenue. What we call waste has economic constituencies. Every prior authorization that takes 6 phone calls, every claim that requires manual review, every incompatible medical record system, these aren't problems to everyone. For some, they are business levers to protect. I recall earlier in my investing career, I was a young analyst at a dinner that became a scene out of The Godfather, where the top CEOs of a particularly Byzantine sub-industry of healthcare IT literally shook hands with each other, promising not to IPO and would only sell to each other or to private equity, to remain private, to prevent the public scrutiny that may come from revealing their egregious EBITDA margins. Margins that would make even the most mercantile Silicon Valley founder blush. And yet these are not margins earned out of superior outcomes, but instead are margins protected through decades of superior lobbying. Regulatory capture masquerading as administrative complexity. Oligopolistic tactics hiding behind interoperability requirements, stifling much needed innovation. As a physician, I took an oath. First, do no harm. But harm isn't just about what we do, it's also what we fail to prevent. When I see AI tools that could detect cancer 2 years earlier sitting unused, when I see algorithms exist that could prevent thousands of medical errors, my oath compels me to fight for their adoption. Allowing preventable suffering when solutions exist is its own form of harm. As a venture investor, I learned the difference between creating value and simply moving it between pockets. True innovation expands the pie. Most healthcare investing today, unfortunately, just redistributes the slices. History teaches us that industries and institutions face a choice: creative evolution or destructive revolution. The record labels that tried to sue away the internet, the taxi cab associations that tried to do the same with Uber and Lyft, they all learned the same lesson. Systems that refuse to evolve don't get to choose the terms of their disruption. The healthcare stakeholders here today, health systems, payers, policy makers, and patients, have to have the courage to dispel the heuristics and pattern matching of the past. It is imperative for every stakeholder to empower and enable the creative and responsible disruption of their own industries, business models, and value propositions. If we fail to do so, we either risk more Luigi Mangionis or we forfeit the moral trust of patients to the whims of Dr. GPT and AI's independent ascension. As investors, we are trained to do this. As venture capitalists, it is the essence of our craft, to predict, empower, and guide the creative disruption of industries. It is what has driven American enterprise to consistently lead in innovation, one technology cycle after another. I view it as my responsibility and for this kind of forum, not to be alarmist, but to present to you what you may not be seeing day to day, the speed of technology development that is upon us, with or without our input, and the forces that hinder the progress of innovation at the expense of the American people and the institutions that serve them. I know it's easy to speak in generalities, but trust me when I say there is no shortage of concrete, actionable opportunities for every stakeholder. Ask my colleague Caitlin of all the opportunities we see in our pipelines to take a leadership position in this endeavor, and it would be my privilege to speak about them with anyone at this forum. To the healthcare leaders in this room, you can be architects of transformation or its victims. To policymakers among us, raise the bar, challenge the incumbents and their rent on our system. Create pathways for innovations while protecting the vulnerable. To my fellow innovators, build with courage. Align first and foremost with patients. Any resistance outside of that is proof of positive disruption. And to all of us, Senator Ted Kennedy envisioned healthcare as a right, not a privilege. For the first time in history, I believe this quantum leap in technology and its ability to reason through complex tasks can make that vision economically viable. But only if we, in each of our respective fields of influence, can have the courage to overcome those who intentionally hinder progress to unreasonably profit from the status quo. The question isn't whether change will come. Technology and human need guarantee it. The question is whether we'll lead that change or be dragged along by it. It's not going to be easy. We all have our competing day-to-day priorities. I get that. But incrementalism is not why Chris and Judd brought us here today. I will end with a quote that gives me goosebumps every time I read it, as Senator Ted Kennedy recited in his tribute to his brother, Senator Robert Kennedy, in his original words. Few are willing to brave the disapproval of their fellows, the censure of their colleagues, the wrath of their society. Moral courage is a rarer commodity than bravery in battle or great intelligence. Yet it is the one essential vital quality for those who seek to change a world that yields most painfully to change. And I believe that in this generation, those with the courage to enter the moral conflict will find themselves with companions in every corner of the globe. I hope to find such companions and shared vision at this forum. Thank you. I guess maybe there's time for questions, if there is. 2 minutes. Well, go ahead.
Thank you. I really enjoyed that talk. I wanted to ask you, since you mentioned that there's many concrete, actionable things that can be done, if you had to just pick one that is a very big opportunity, what would you say?
A very big opportunity that I think for the first time in a long time you're seeing willingness on two adversarial sides of a massive, massive market come together is in the realm of claims and prior auth adjudication. We've heard of it. I know it's not necessarily new, but the amount of provider abrasion and payer scrutiny that they are under has created an opportunity for both providers and payers, I believe, to engage in a potentially beekeeper-like central medium where you can leverage the latest networking technologies and obviously built on the latest AI rails to be able to actually at a granular level be able to industrialize policy recommendations like gold carding. I'm not sure if everyone's heard here about gold carding. Essentially says, hey, if you're a provider that has done pretty well, you don't need to submit prior auths. Saves the provider time, it saves the payer time. This is all, like, as I was saying in my short little talk, this is a revenue that is extremely inefficient. It hurts patients, it hurts providers, and it's something that payers are almost forced to do because they don't have better tooling. Today, those tools exist, but you have to have, as again, the moral courage to take a couple quarters of an earnings hit to be able to pull that through. So I hope forums like this can enable some folks to think that way. All right, only 10 seconds, so I hope to continue this discussion with you guys elsewhere.